Politics producer. I'm supported by our news and politics teams. We are all working from home, so apologies in advance if there are any technical issues or if one of my cats jumps in front of the camera. That is a thing that has been known to happen. Again, if you are just tuning in, I am NowThis senior politics producer, Alan Piper. We are expecting the President of the United States at any moment. We'd like to try to use the time while we're waiting to answer some of your questions. So please type them in the comments on Facebook or tweet them at me at apiper13, and we will do our best to answer as many of them as we can before the President comes out. Now, today marks 6 months since President Trump said of the coronavirus, quote, "We have it totally under control. It's one person coming in from China. It's going to be fine." Since then, more than 142,000 Americans have died and nearly 4 million have been sickened. Things are not under control, and they are clearly not fine. Yesterday, President Trump admitted as much, saying, quote, "It will probably, unfortunately, get worse before it gets better." These are hard words to hear, considering how bad things have been. We are back to suffering roughly 1,000 deaths a day. We are back to having a backlog of tests and shortages of hospital beds and PPEs. The purpose of the nationwide shutdowns that happened in March and April was never to just hide out until the virus went away. It was to buy ourselves time during which we could prepare and develop a nationwide plan. And tragically, that time appears to have been wasted, and there is no national plan. As we know now, the plan that had been put together by the previous administration, the 69-page pandemic response playbook, was discarded. If the allegation in Mary Trump's book is true, that Donald Trump cheated on his SATs and paid someone else to take the test for him, it is unfortunate that he didn't follow that same practice this time around and use the work someone else had done with the Obama-Biden pandemic playbook and just claim it as his own. Because who gets credit for it doesn't really matter. What matters was that we should have tried to prevent the grave number of deaths and sicknesses and hospitalizations that we have experienced. Again, if you are just tuning in, I am Alan Piper, NowThis senior politics producer, broadcasting to you live from my home in the East Village of New York, which is no longer the global coronavirus epicenter because New York took aggressive countermeasures and has successfully gotten the disease under control for now, though we could screw it up if we get cocky. There's still time for that. President Trump has repeatedly suggested that the only reason the U.S. has more cases than any country in the world is because we are doing more tests than any country in the world. He's neglecting that what is most important is the positivity rate of tests. And the proof that doing more tests doesn't mean that you'll have more cases if the virus is under control is New York. New York is conducting more tests than any other state in the country. And New York has a positive rate of tests of about 1%. That is to say that 99% of the tests that are performed come back negative. The Harvard Global Health Institute has said that ideally you want the positivity rate to be below 3%. The World Health Organization has said that anything over 5% is unsafe, is out of control, and is unsafe for reopening the country. The U.S. rate for the past week has averaged over 8.5% positivity. And in many of the states that were earliest to reopen, that number is frighteningly much higher. Nearly 25% of people who take tests in Arizona have those tests come back positive. And the actual number of cases in Arizona is probably much higher than Arizona public health officials believe that it is, because they are not doing as many tests as New York is doing. So while we are waiting for the President of the United States to come out, we would like to invite you to pose questions to us. We will do our best to answer them with the support of our producers in our virtual newsroom. All of our producers are, in fact, actually working remotely at this time. Now, it is only Wednesday, but President Trump is having a pretty rocky week. It started with the Fox News interview that aired on Sunday with Chris Wallace, during which he bragged about passing a cognitive test. It is believed that he was referring to the Montreal Cognitive Assessment. This is not an IQ test. This is a test to determine if someone is non-compass. The questions asked include asking if you can identify an elephant from a series of pictures of animals, asking do you know what city you're in. The fact that doctors felt such a test was needed for the President of the United States is troubling. The fact that President Trump described the test as very difficult is also troubling. And the fact that he has boasted that the doctors were, quote, very surprised that he was able to pass it is, I think, what one would refer to as a self-own. So that was how President Trump started the week. And he has been continuing it by announcing that he is sending troops into Chicago against the will of the mayor. It's interesting to note that one of his earliest threats as president was that he might invade the city of Chicago, and it appears that that is a promise he is keeping. It is interesting that the president, while he does not keep all his promises, spoiler alert, Mexico is never going to pay for that wall, he does keep a startling number of his most disturbing promises. I would avoid standing on Fifth Avenue in his presence just in case he decides that he actually can shoot someone. We have a question from Barbara. Barbara asks, if hospitals are no longer reporting to the CDC, how are we keeping track of COVID numbers? Well, last week, the White House announced that all data from hospitals should be sent directly to the Trump administration through the Department of Health and Human Services and actually getting to them through a private contractor, bypassing the CDC. Now, HHS will supposedly collect the daily reports about patients that each hospital is treating and the number of available beds and ventilators and other information vital to tracking the pandemic. HHS officials said that the CDC system was inadequate, but would continue to make the data public. But many health officials were shocked by this change of process and have questioned whether President Trump will use this to try to conceal accurate information about the true case count and death toll of this virus. And lest that seem alarmist, surely the President of the United States would not mislead the public about something as crucial as the state of a rapidly spreading pandemic. The President of the United States has done little else since this crisis emerged. We know that he was alerted, that his intelligence officials were alerted early in the process. There was reporting that the intelligence community was warning of this as early as November 2019, and yet throughout all of January, all of February, and most of March, President Trump suggested that this virus was not a threat, even as his own intelligence agencies and his own HHS department and his own CDC were warning that it was, in fact, a terrible threat. So it is indeed very alarming to think that President Trump could have the ability to conceal data from the public. And it's important to note that we need to know the spread of this virus for many reasons. President Trump has voiced clearly that he thinks that Democrats want people to know how bad it is because it's politically bad for him. It may well be politically bad for him, but it is important simply for public health that we know where this disease is, how it's spreading. There is no way that communities can prepare to protect themselves. There is no way that individuals can make safe life choices if we don't know the truth about the threat of this virus. Now, Noah asks, why is Trump sending troops into our cities, or what are they there for? Well, President Trump is threatening to send law enforcement into multiple cities run by Democrats where he claims that violent crime is surging. Now, it is important to note that in many of these cases, he is grossly exaggerating the crime that exists. While it is true that there has been a marginal uptick in crime in New York City, particularly crime involving gun violence, I'll mind you, President Trump has not taken action to address any gun reform policy, which might be helpful in addressing an increase in gun crime in New York City. Despite a recent increase of crime in New York City remains, per capita, one of the safest localities in the nation. And so it is quite startling and astonishing to suggest that it is in such dire straits that it requires an invasion of federal troops. Now, federal forces were deployed to Portland and have clashed with protesters in recent days. Portland officials have condemned the presence of these unmarked stormtroopers, as they've been called. Stormtroopers in camo with no identification have been pulling people off the street, hauling them into trucks without warrants, without presenting identification. This is what is commonly referred to as kidnapping, and yet this has been taking place in a U.S. city at the direction of the President of the United States against the wishes of the duly elected leaders of that city. And President Trump announced today that he is sending similar forces into Chicago, again against the wishes of Chicago's mayor, Lori Lightfoot. We released a video earlier today. Shelby, if you're able, perhaps you can put our video in the comments of this thread so that our viewers can see it. We released a video that included Mayor Lightfoot's comments from yesterday. She also tweeted, quote, "Under no circumstances will I allow Donald Trump's troops to come to Chicago and terrorize our residents." In a letter Monday, more than a dozen mayors from Seattle, Atlanta, Boston, Philadelphia, Denver, Los Angeles, Tucson, and elsewhere have called on the administration to withdraw federal forces from the cities where they are currently deployed and to halt plans to send them elsewhere. President Trump has named New York, Philadelphia, and Detroit as among those cities where troops could soon be deployed. It is interesting to note that at a moment when there are so-called patriots saying that a requirement to wear masks is a dangerous infringement on their liberty, these self-same patriots are not decrying the deployment of stormtroopers into cities to scoop citizens up off the street without warrants, put them in trucks, and drive them off. This is the scenario that the NRA has used as justification for the need for citizens to have access to assault-style weapons to protect against potential acts of tyranny from a tyrannical government. We have not seen a need for that in the past. The rumors that President Obama was going to invade Texas turned out to be nothing more than wild conspiracy theory promoted by elected officials in Texas. But the reality is that scenarios very much like that have been taking place in Portland and seem likely to begin taking place in Chicago and possibly soon other cities. So, those are the questions that we've answered from Barbara and Noah. I am checking my Twitter feed to see if there are other questions. You can post questions in the comments on Facebook. You can tweet them at me at apiper13. Again, if you are just joining us, I am Alan Piper, now the senior politics producer, and we are expecting the President of the United States at any moment to give his rebooted version of the daily coronavirus briefing. Now, throughout March and April, he held these briefings daily, but stopped abruptly after being mocked for suggesting at the end of April, on April 23rd, in fact, that people could be injected with disinfectant as a treatment for COVID-19. The next day, he held a very brief press briefing where he suggested that he had been joking when he had said that the day before, and he tweeted that these briefings were not worth his time, and he subsequently moved on. But this week, citing the, quote, great ratings that these briefings got, that is television view numbers, it seems to be an odd metric to follow. Here we go. The President of the United States. We will attempt to fact check him in real time.
Thank you very much. Thank you. Today, my administration reached a historic agreement with Pfizer to produce and deliver 100 million doses of their vaccine immediately following its approval. Hopefully, the approval process will go very quickly, and we think we have a winner there. We also think we have other companies right behind that are doing very well in the vaccines, long ahead of schedule. As part of Operation Warp Speed, this agreement will also ensure that we receive an additional 500 million doses shortly thereafter. This is another crucial step in our effort to develop, manufacture, and distribute a vaccine in record-breaking time, really a very small fraction of the time based on previous schedules. I want to thank the FDA. I want to thank everybody involved. It's been an incredible process. As discussed yesterday, the China virus poses the greatest threat.
Okay, so a couple of things. First of all, the President is talking about the vaccine as if it already exists. It is important to note that no vaccine exists at this time. And many health experts have suggested that this timeline is too aggressive, is in fact dangerously
among less than 1%.
Dangerously aggressive, because the thing about a vaccine, the reason anti-vaxxers are ridiculous is because typically vaccines go through lengthy, in-depth, careful testing to make sure that they are medically safe. This takes time. It is crucial that they be medically safe because unlike a treatment for a disease you already have, where one could ask the question that the President frequently asks, what do you have to lose? Vaccines are given to healthy people. So if they are not safe, they have everything to lose. And so many health officials have expressed grave alarm at the speed with which this administration seems to be rushing ahead of the science in declaring that a vaccine is safe. Secondly, he has again referred to this as the China virus. Viruses do not have nationality. This is a virus. It does not belong to China any more than it belongs to the United States, although the United States could claim ownership of it since we have more cases of it than any other nation. Even so, I don't recommend calling it the U.S. virus, but that is a more accurate name for it if one is insistent on labeling it with a nationality.
Facilities. Second, HHS will be distributing an additional $5 billion from the Provider Relief Fund to all nursing homes. Nursing homes in higher risk areas will be receiving more funding. This money can be used to address critical needs, including the hiring of additional staff, increasing testing, and providing technology support so residents can connect their families, and they can connect to their families. They are having a tremendous time. They want to be with their loved ones. They can't do it. So what we're doing is we're working it so that we can connect, have them connect with their families if they're not able to visit. Third, we've been identifying especially high-risk nursing homes and sharing that information with the governors so that the governors and their staffs can take appropriate action. We're able to find, because of the testing programs and other means, we're able to find certain areas that are very high risk. The governors can then take action. Additionally, CMS, CDC, and the U.S. Public Health Service are providing enhanced technical assistance and support, including visits to the highest risk nursing homes, and that's their priority right now. Nursing homes, but the highest risk nursing homes. CMS and CDC are implementing a national training program focused on infection control for those nursing homes that need it most. And we have them surveyed, and we have them mostly pinpointed. Over the past few months, we've created a surveillance system to detect outbreaks, and currently 99% of all nursing homes are reporting directly to it. So we have great data. When a nursing home has 3 or more cases, we alert the state and make sure that it responds very quickly. We check on it, make sure they respond very quickly. I want to send a message of support and hope to every senior citizen who has been dealing with the struggle of isolation in what should be the golden years of your life. We will get to the other end of that tunnel very quickly, we hope. The light is starting to shine. We will get there very quickly. But we send our love. We send a message of love.
President Trump says that we will get there very quickly. We are seeing the light at the end of the tunnel. Just yesterday, he acknowledged that it will probably get worse before it gets better.
Cases in the South and Southwest and the West. We're closely monitoring and aggressively acting to control the infection in Texas, Arizona, California, Florida. Arizona is starting to come down. Done a very good job. They're all doing a good job.
It is not true that Florida and Arizona are starting to come down. They have, in fact, both states have been breaking records in terms of new cases reported per day.
You know very well about, which presumably triggered a broader relaxation of mitigation efforts nationwide, and a substantial increase in travel also was a cause. Increased gathering on holidays such as Memorial Day, as well as young people closely congregating at bars and probably other places, maybe beaches, 4 or 5 different listed places. We have 12 that are listed on the guide, likely also contributed. We're also sharing a 2,000-mile border with Mexico, as we know very well, and cases are certain.
So the president is making multiple false statements here. He is suggesting, first of all, that anti-racism protests are among the leading cause for this spike in new cases. There is no evidence to support this. In our coverage of the anti-racism protests, we have seen that that protesters have, for the large extent, been wearing masks. Protests where masks have not been seen were the anti-lockdown protests that President Trump himself encouraged when he tweeted, "Liberate Michigan, liberate Virginia." President Trump also now seems to be blaming Mexico for the introduction of this disease. It is important to note that this disease was rampant in the U.S. before it became problematic in Mexico. Currently, the U.S. has more than 11 times the number of cases of Mexico. The U.S. states that border Mexico combined have more than double the number of cases that Mexico has. If one country is a threat to the other, it is clearly the U.S. that is a threat to Mexico, and this, in fact, might be the most compelling argument to get Mexico to, in fact, pay for a wall.
The supply of remdesivir for early case intervention and steroid treatment and various other treatments for those that are seriously ill. We're working very closely with hospitals, doctors, nursing homes, everybody.
I also, as Ian McKenna in our newsroom has pointed out, President Trump blamed holiday celebrations just now for the spread. He held two holiday celebrations. He held a maskless, no social distancing, essentially rally on the taxpayer dime in South Dakota on July 3rd, and another one on the White House lawn on July 4th. He has been reluctant to wear a mask in public. He, this week, tweeted a photograph of himself wearing one, suggesting for really the first time that it is patriotic to be wearing a mask. He has previously suggested that people who wear masks are doing so to make him look bad. He has virtually single-handedly turned the wearing of masks into a divisive political issue.
We think that in a very short period of time we'll be able to do that. Our strategy is to shelter the highest risk Americans while allowing younger and healthier citizens to return to work or school while being careful and very vigilant. Wear a mask, socially distance, and repeatedly wash your hands. Practice very, very good sanitary means. You have to do this. You have to you have to look at it differently. Wash your hands often. I'm finding more and more people are saying wash your hands. So wash your hands. We want young Americans to avoid packed bars and other crowded indoor gatherings, and we're all in this together. And as Americans, we're going to get this complete. We're going to do it properly. We've been doing it properly. Sections of the country come up that we didn't anticipate. For instance,
it is striking to hear President Trump say that we are all in this together. He has repeatedly and routinely attacked Democrats, attacked Democratic governors, and in fact attacked the very Democratic governors, the governor of Michigan, the governor of Washington, and the governors of New York and New Jersey, the very governors who have been the most aggressive and the most successful in getting this virus under control. It has not been the case that he has been acting as if we are all in this together. Also, Ian McKenna from our newsroom has highlighted that a June 2020 study from the National Bureau of Economic Research concluded, quote, "We find no evidence that urban protests reignited COVID-19 case growth during the more than 3 weeks following protest onset. We conclude that predictions of broad negative public health consequences of Black Lives Matter protests were far too narrowly conceived."
Have been very bad. As far as the coronavirus, as you say, I think we've done some amazing things, and I think you'll probably see that if you compare our statistics to other countries, and if you look at death rates, et cetera, you're going to see, and especially into the future with what's happening, you're going to see some very, very impressive numbers for the United States. John, please. Go ahead, John.
The numbers for the United States are impressive, but not in a good way. It is hard not to be impressed by the fact that a country with roughly 5% of the world's population has about a quarter of the cases and a quarter of the world's deaths from this disease. We have more cases and more deaths than any other nation. This is impressive indeed, but not in a good way.
See the schools open, especially when you see statistics like this. We have great statistics and on young people and on safety. So we would like to...
The statistics on young people and on safety are in fact not great. In Florida, roughly a third of people under 18 who have been tested have tested positive for the virus. Roughly a third. There have been more than 175,000 kids in the U.S. who have gotten sick from this. At least 228 have died. And while that is obviously a lower death rate than adults, the loss to those families is incalculable. Only about 1 in 10 Americans think that it is appropriate to open daycare centers, preschools, or K-12 schools this fall without restrictions, according to the latest AP poll.
Do with children and safety, they're very impressive. They have very strong immune systems.
But you would understand that the children who go to school, then go back to home, they're with, some live with their grandparents,
Sure.
there's a real risk. Would you understand if some
Well, they
schools...
do say that they don't transmit very easily, and a lot of people are saying they don't transmit, and we're looking at that. We're studying John very hard.
Okay, this is actually thought now not to be the case. There is some research that suggests that children under 10 may be less likely to transmit the virus, but that does not mean that they are incapable of transmitting the virus. And this latest research suggests that children 10 and up are in fact no less likely to transmit the virus than adults. It is also important to note that the Kaiser Family Foundation has determined that about a quarter of U.S. teachers fall into high-risk categories for this disease. And nearly a third of U.S. teachers are over 50. So however resilient the youthful child immune systems are, that does not protect those teachers.
Hospitals and various, or when I'm close, when you can't socially distance, I believe in it. Let's see, do I? I do. I have it. And if in certain instances, I think you really, I think you want to travel with a mask. There are instances where you really can use it. I would believe it would be a good thing. Yeah,
sir,
please.
one just follow-up. D.C. Mayor Bowser came out with such an order today. It, of course, doesn't apply to federal properties, but would you encourage federal properties, and including the White House complex, to follow the order?
We're gonna make a decision over the next 24 hours. We'll let you know what that decision is. Okay?
Thank you.
Thank you. Please.
President Trump, do you agree with Senate Republicans discussing the possibility of extending short-term unemployment insurance today so that they prevent benefits from expiring?
Well, I think a lot of politicians are discussing that, Republicans, Democrats, and right now a lot of my representatives are on the Hill. They're discussing CARES Act or Phase 4, whatever you want to call it. And I think ultimately something good will come out of it. The economy is starting to really come back strongly when you look at the numbers, even with the fact that, like, California is still closed up in many big states. I think the numbers are even more impressive considering that some states, like California, big ones, are pretty well shut down. So we expect to have something over a period of time, over the appropriate period of time.
Over the appropriate period of time. Well, the House passed the HEROES Act over 2 months ago. We are now nearing the later stage of July. Rents are due on August 1st for millions of Americans, and some 28 million Americans are at risk of not being able to pay that rent and facing eviction, while the Senate, Mitch McConnell's Senate, has delayed action on any further relief for Americans.
We're really waiting for them to call for the big help, for the big numbers, for the large numbers of people that we have ready, willing, and able. You look at Chicago, where 14 people were shot yesterday, where over the weekend many people died and many people were shot, and over the last month they're setting record numbers. We are waiting for the mayor, respectfully, and other mayors and governors to call us. We are ready, willing, and able to go in there with great force. Now, we also have people that are going in and arresting drug dealers, arresting some of the shooters that are doing the shooting. We know who they are. We're working with police forces, and even though in some cases they're told don't work with the federal government, the police forces have great respect for the federal government, what we do. But we're ready, willing, and able to go into these cities that are just being decimated with shooting, and we're going to help. Please.
Now, it is so, all right, several things here. President Trump is suggesting that Democratic-led cities are facing just out-of-control crime waves. This is, for the most part, not true. But what is true is that there is, throughout the U.S., an epidemic of gun violence. And Chicago is one of the cities that is impacted by this. It does not have the worst gun violence, even though Republicans often suggest that it does, but it does suffer from gun violence. The House has passed gun reform legislation, basic non-controversial gun reform legislation that includes things like red flag laws and universal background checks, which are supported by the vast majority of Americans, including Republicans, including NRA members, including gun owners, and yet the Senate, Mitch McConnell's Senate, has refused to act on these, and President Trump, who who has received the endorsement of the NRA, has refused to make gun reform a priority, instead suggesting that any gun reform is an effort to get rid of the First Amendment. There is a very common talking point about Chicago that gun enthusiasts like to use. I did an experiment with activist Igor Volsky to find out the truth about that talking point, and I'm going to put that video into the comments for your edification.
Chicago, he could have solved the problem, and he didn't. In our case, they don't want us in. We can solve the problem very easily. We're equipped with the best equipment, the best people, and you see what we're doing. I mean, Portland was coming down. It was busting at the seams, and we went in and protected all the federal buildings. Those federal buildings are totally protected. And we had to do that. And Portland's a very different place than Chicago. But Chicago should be calling us, and so should Philadelphia and Detroit and others, to go in and really help them. Because when you're losing many people a weekend, many people, you see the same numbers as I do. When you're losing these people, they should call us and they should say, come on in. And it's incredible to me, but they're not doing it. At some point they will. At some point we may have no other choice but to go in. Jeff, please.
Mr. President, are you looking at closing further Chinese embassies in the United States? And did you ask Ambassador Woody Johnson to bring the British Open to your Turnberry property in Scotland?
No, I never spoke to Woody Johnson about that, about Turnberry. Turnberry is a highly respected course, as you know, one of the best in the world. And I read a story about it today, and I never spoke to Woody Johnson about doing that. No. As far as closing additional embassies, it's always possible. You see what's going on. We thought there was a fire in the one that we did close, and everybody said there's a fire, and I guess they were burning documents or burning papers, and I wonder what that's all about. Okay, how about one or two more, please?
Thank you. Would you like to respond to Joe Biden, who today described you might have heard that, as the first racist to be elected president? That was his words.
Well, you know, it's interesting because we did criminal justice reform. We passed criminal justice reform, something that Obama and Biden were unable to do. We did opportunity cities. We did the greatest. If you look at what we've done with opportunity zones, nobody's ever even thought of a plan like that. Prior to the China plague coming into our country and really doing terrible things all over the world, doing terrible things, we had the best African American, Hispanic American, Asian American, almost every group was the best for unemployment. The unemployment numbers were the best. You look at employment, you look at opportunity zones, and maybe most importantly, you look at criminal justice reform, you look at prison reform. I've done things that nobody else, and I've said this, and I say it openly, and not a lot of people dispute it. I've done more for black Americans than anybody, with the possible exception of Abraham Lincoln. Nobody has even been close. Thank you very much.
Okay, that is a false statement when President Trump says that he has done more for black Americans than any president, with the possible exception of Abraham Lincoln. That is so patently false, it is not possible to break it down on an individual basis, but it is worth noting that several of the most major pieces of anti-racism legislation were passed during the Lyndon Johnson administration. In terms of the claim economically that he has been the best president for black Americans, President Obama presided over the largest ever drop in black unemployment. And while black unemployment did reach a record low under President Trump, it was still roughly double that of white Americans. And what matters as much as having a job is what the job pays. Black median income fell by $2,000 under Trump. And then in this crisis, black unemployment climbed to the highest level in more than a decade in May. And the small recoveries in jobs that we have seen have disproportionately left out black Americans. Now, in terms of a couple of other things that were mentioned there, President Trump, I want to focus on the gun situation, because it is absolutely true that there is too much gun violence in the U.S., and it is absolutely true that there is too much gun violence in Chicago. But this idea that Chicago needs to be invaded by federal troops to stop this gun violence is it's not what President Trump is claiming. I would like to call your attention to the fact that per capita, these are the states with the greatest amount of gun deaths. The greatest amount of gun deaths per capita are in Alaska, Louisiana, Alabama, Mississippi, Montana, Wyoming, Arkansas, Oklahoma, New Mexico, and Tennessee. Those are the top 10 states in gun deaths per capita. All but one of them is a traditionally red state, and President Trump is not talking about invading any of these states. And he also is not talking about passing common sense gun reform that would be supported by the majority of Americans. A couple other things that came up. President Trump was asked about whether he had used his diplomatic influence to try to drive business to his golf resort in Scotland. The New York Times reports, quote, "The American ambassador to Britain, Robert Wood Johnson IV, told multiple colleagues in February 2018 that President Trump had asked him to see if the British government could help steer the world-famous and lucrative British Open golf tournament to Trump Turnberry Resort in Scotland," according to 3 people with knowledge of the episode. Now, President Trump has often tried to use the presidency to generate business for his properties. This would seem to be in violation of the Emoluments Clause of the Constitution when it involves monies from foreign entities. He earlier reportedly sought to hold the G7 Global Summit at Trump National Doral Resort in Florida. That would be the best press that the Doral Resort would have, a welcome relief from the widespread reports of a rampant bed bug. Bed bug is not so easy to say. Rampant bed bug problem reputed to have plagued Doral Resort. Now, Ambassador Johnson was advised against making the request from his deputy, who warned that such a move would be an unethical use of presidential power for personal gain. However, Johnson ignored this advice and proceeded to make the request to Scotland's Secretary of State. Johnson's deputy flagged this discussion to the State Department, and the deputy was forced out of his role months earlier. This is according to reporting from the New York Times. Now, I also want to answer one more question from the audience that we didn't have a chance to get to. Arlie asks, why do the results of President Trump's COVID-19 tests come back so much quicker than normal citizens' tests? On May 13th, the New York Times reported that the White House uses the ID Now system from Abbott Laboratories, which the president often cites as the 5-minute test. Abbott says their device is able to deliver positive results in as little as 5 minutes and negative results in 13 minutes. Several studies have raised concerns about the accuracy of the Abbott test, with a study by NYU researchers finding it missed close to half of positive samples as compared to competitors' testing systems. Now, the length of time in getting tests back is a crucial issue, and it's why it's not important just to have the most number of tests. We need to have the ability to process these tests quickly. Members of our own newsroom who have taken tests have reported that they have faced wait times of over 10 days to get the results. During that time, they don't know whether they are at risk of passing the disease to someone else because they don't know if they have it. It is impossible to affect contact tracing, mitigation, isolation of people who are at risk, controlling the spread of the disease. All of that is impossible if there is not a rapid turnaround of these tests. So that is where we are today. This is today's briefing from the President. It's worth noting that in this reboot, in this rebranding of the Coronavirus Task Force briefings, notably absent are the voices of Dr. Fauci and Dr. Birx or any other medical health professionals. You are instead getting your information about this deadly virus from the President of the United States, who I must warn you is not a doctor and has frequently given dangerous and unsound medical advice. In the time that President Trump was speaking today, roughly 100 Americans have died from the coronavirus just during the time of this briefing. Thank you for tuning in. I had support today from Ian McKenna, Alex Rabinowitz, Shelby Baculin, and others in our newsroom. Please stay safe. Please take care of the people that you love, and please take advantage of the time that you have to let them know how much you love them. We will get through this together. For now, I am Alan Piper. Thank you. Be safe, and have a good night.